Hello, I'm Dr. Marla Shapiro, and I have the pleasure of being on the Board of Trustees of the International Menopause Society. Today, I am joined by Dr. Rossella Nappi, and we will be talking about a subject that's very important for women in general. But first, let me introduce Dr. Nappi. She is a professor of obstetrics and gynecology at the University of Pavia, Italy, director of gynecological endocrinology, IVF, and menopause research. So, for our women who are with us, Dr. Nappi, what we want to talk about is something that most women don't want to talk about, and that's the health of their vaginas. Women are reluctant to use the word vagina, and certainly when we talk about vaginal atrophy, the word atrophy is so negative, and most women don't even know what it is or why it happens. So, can you explain to women what is this?
Yeah, you're right, Marla. Vaginal atrophy is not a word that women use. They don't know this word. What they know that they feel different when they enter menopause down there. The vagina is less lubricated. They feel uncomfortable during sexual intercourse and they feel pain. They may have also burning and itching in the vagina, and they believe they have just an infection and mushroom, and they try to fix by themselves this condition without talking so much, because of course the vagina is something intimate, is a sensitive topic, and somehow women they believe that they are most important thing to discuss with the physician. Let's say high cholesterol, the risk of osteoporosis, and I believe also that menopause has to do with hot flashes, and probably vaginal dryness is just something that comes with aging. And so they feel they are entering this aging process and they cannot do nothing about this condition.
So that's an important point for women to recognize that although it happens later in menopause, it's because estrogen declines. And with the loss of estrogen, you then get these symptoms. Women often don't understand it's because of the loss of estrogen. So let's talk about how many women get this. Does every woman get this? And why is it important for them to be talking about it with someone like you?
We conducted many surveys over the year across the world, and we find out that more or less 1 out of 2 women suffer from this condition in a moderate or severe form. And many of them, unfortunately, stop having sexual intercourse and sexual intimacy because of that. In the menopause clinic is even worse because in a very recent study, up to 90% of women coming to many clinics across Europe, but more or less this data also in the US and in many other parts of the world, they suffer of one or more symptoms of vaginal atrophy, not only dryness and sexual pain, but also urinary symptoms, even incontinence and recurrent urinary infection, and therefore they are really in need of a treatment. Women, they should be aware that this is a condition that is related to hormonal changes, exactly as hot flashes, but the difference is that hot flashes usually they relieve over time, whereas vaginal atrophy is progressive, and therefore we really need to start to be proactive with ourselves and discussing with the physician in order to avoid irrevocable changes of the genitals of the vaginal tissue.
Important for women to also recognize that you've done a lot of studies that show that this impacts relationships.
Yeah, exactly. Because, sometimes when you enter menopause, there are so many other changes occurring in your life that you believe that is just the stress, long term relationship. You have many other problem in your general health or mental health. You don't feel okay because of the syndrome. But it's not true. It's just because if you feel pain during sexual intercourse, then sooner or later you will lose your energy in the relationship, your sexual drive. You will avoid intimacy with your partner. So you will change really the way you behave in the couple. And even males suffer from the condition. It's an indirect effect. We discover in a very famous study we conducted, the Closer study, that there is an impact also on the quality of the dialogue within the couple. So we really need to keep in mind that treating VVA is not just a question of having sex, is a question to keep a relationship alive with our partner and feeling intimate. It's really something nice during the process of aging, not only at midlife. We have to consider this dimension of happiness together. And VVA is in this business.
So then let's talk about treatment. Many women will try a moisturizer or a lubricant that's over the counter, but it doesn't really correct what's happened to the tissue with the loss of estrogen. So many women are fearful about treatment. Can you explain about what the options are and the safety related to the use of these local products?
We have many local hormonal estrogen products that can be extremely helpful. Now, these low dose product, they demonstrate very clearly that they have a safe profile, and women they can use that without fearing so much that this hormone will go around your body and they will affect the breast cancer risk, that it's really the risk that women they fear most. Of course, we have to explain as well that this treatment should be used according to the prescription of the doctor. So, and this is the reason why some women they prefer a quick fix, they prefer something they can do by themselves because they don't want to be medicalized. But women they should be aware that if this condition is there and the reason is the lack of estrogen, they should correct with local estrogen therapy. Otherwise, they will never revitalize the tissue from the inside. And so they will just put some gloss on the vagina, but this will not do some good to the core of symptoms, not only pain during intercourse, but also what is happening in the pelvic floor in terms of recurrent urinary infection and urinary function in general. Always it's better to follow the advice of the physician. So you cannot do by yourself for so long. You should go back annually to try to figure out if the strategy you selected is still good for you.
I think the most important message that I hear you telling women is that this becomes almost a conspiracy of silence. Often, because when you see your healthcare practitioner, someone like you or me, we have so much on our agenda that we're focused on. Women are more worried about their breasts or they're worried about heart disease. But this is a very important part of estrogen loss, the impact, and the importance of empowering women to feel safe to have the conversation about what is happening to them and not assume this is just a normal part of aging.
Yeah, but it's also a duty of the physician to break the ice
I
with
agree.
women because they sometimes they are shy and they still have some taboos. Think about the many women across the world that they have a different culture. So is the sensibility of the healthcare provider that is very important. So it's very simple question. Many women have this problem with age and menopause. Is happening to you to have vaginal dryness is an easy way to make this conversation comfortable, and you will see that women they will start talking easily, and you can do a lot of education if you just break the ice and then you
But
treat
that's for
your
women.
patient.
That's for women who have a healthcare practitioner who will break the ice. But if they won't break the ice, what would you tell women to do when they see their healthcare practitioner?
They should ask, please ask if you feel that you have some symptoms that you don't understand, it's recurrent, it's something that affect you down there, and it's dryness, it's pain, please ask. The physician at that time will pay attention. Of course, it will try to rule out maybe infection. It will try to do some workout, but then you will get your treatment. You will see. So go ahead.
Strong words. Thank you for being with us today. And women, take Dr. Nappi's advice. Don't be afraid to have the conversation. We thank you for joining us today.